Okay, so welcome to today's lesson for medicine, and today we're going to look at a condition called cardiovascular accident, which is commonly called a stroke or known as a stroke. So this is the condition that we'll look at in medicine today. Okay, so when you look at, we can define cardiovascular accident as this is a central nervous system condition in which there is sudden impairment of cerebral circulation in one or more blood vessels supplying the brain, characterized by hemiplegia, uh, aphasia, which is loss of speech, and also sudden loss of consciousness. So when it comes to uh, CVA, which is a stroke, this condition affects the central nervous system. And whenever you're defining, you need to give a system where this condition is coming from. And apart from giving us a system, you need to tell us which part of an organ in that system is being affected. So therefore, we have mentioned to say it is this condition results in sudden impairment of cerebral circulation, meaning blood supply and oxygen supply is impaired to that particular part of the brain, and this is the organ being affected in this central nervous system region. Then a characteristic, so what clinical manifestations are you going to see in an individual who has suffered from a stroke? So again, in a definition, you need to give clinical manifestations. So I've mentioned to say there will be hemiplegia. Hemiplegia is paralysis of a particular part of the body. So it could be maybe this individual is going to be paralyzed on the left side or the right side. So that is paralysis, and this is due to lack of oxygen supply to the brain cells or brain tissue, and this results in dying of the brain tissue, and then you see someone becoming paralyzed. Apart from that, there is sudden loss of consciousness. An individual may just collapse and become unconscious, and this is because there is a short for supply of oxygen and blood to the brain. Then someone collapses. Apart from that, there is also loss of speech, which is called aphasia. So loss of speech is another characteristic, and this can even be seen sometimes it could be immediately before the patient collapses, and this will be another clinical manifestation. When the patient even recovers, you see that they will have difficulties to speak, and this is because there will be distraction of the brain tissue, resulting in them having difficulties to speak. And before they collapse, you will see someone even maybe becoming quiet or mute for some few seconds, and then they collapse because at that particular point there is an interruption in how oxygen is being delivered to brain tissue, causing necrosis, and then you see those characteristics. So these are some of the things that you're going to see apart from other characteristics in CVA, cardiovascular accident, which is also called a stroke. So we can move on to the causes. When it comes to causes of cardiovascular accident, there are basically three. It could be cerebral embolism, thrombosis, or hemorrhage. So when it comes to cerebral thrombosis, here this is mostly the common cause of cardiovascular accident. So when it comes to the cerebral thrombosis, it's a common cause of cerebrovascular accident, and this mainly happens to middle-aged individuals and also the elderly people. And this will result in obstruction of blood vessels by a thrombus or a clot, in other words. So this mainly you will see a clot blocking supply to the particular part of the brain, then someone ends up suffering from a stroke. Then when it comes to cerebral embolism, so when it comes to cerebral embolism, this is also the second common cause of cardiovascular accident, and this one can occur at any age, and this is especially to patients who have history of rheumatic heart disease, endocarditis, post-traumatic valvular diseases, myocardial fibrillation, and other cardiac conditions. You see them suffering from cerebral embolism, and this is due to a dislodged clot which may go and block which may go and block cerebral arteries, impairing blood circulation and oxygen to the brain. So when it comes to also predisposing factors of CVA, you find that cardiac conditions are number one predisposing factors. That's why you see in terms of embolism, a clot can even come from the heart and ends up blocking the blood vessels supplying the brain, which has cerebral arteries, and then someone ends up having a stroke or a cerebrovascular accident. Then the last cause of CVA is cerebral hemorrhage, and with cerebral hemorrhage, this mainly results from chronic hypertension or aneurysms, which cause sudden rupture of cerebral arteries. So in terms of cerebral hemorrhage, it could be someone who has a chronic hypertension and which they have not been controlling, and this may result into rupture of cerebral arteries, and then someone begins to bleed in the brain. And apart from that, it could be just an aneurysm where the artery just ruptures because it has become too weak to withstand the pressure of the blood. Then someone ends up having stroke because they are hemorrhaging in the brain. So when it comes to the causes, these are most the specific cause of CVA. So we can move on to the risk factors or the predisposing factors of CVA. So when it comes to the predisposing factors, we have predisposing factors such as atherosclerosis. So history of atherosclerosis, where you have maybe fats accumulating in blood vessels. This may increase the chances of development of thrombus and also blood clots, which may impair blood supply to the brain tissue. Hypertension is another risk factor of CVA because due to increased blood pressure being exerted on the blood vessels, it may increase the chances of rupturing of those blood vessels, causing an aneurysm, someone bleeding, impairing supply of blood to the brain itself and oxygen, and then someone ends up having a stroke. Arrhythmias are other predisposing factors. Electrocardiogram changes, it could be a change in the way electrical impulses are being transmitted to the heart, and then the heart begins either to give a lot of blood in terms of output, and someone may increase the chances of aneurysms, rupturing of blood vessels. Rheumatic heart disease is another predisposing factor. Remember, in rheumatic heart disease, there is fibrosis of the heart valves, and this may result into dislodgement of an emboli, which may dislodge and go and block arteries or blood vessels supplying the brain. Diabetes mellitus is another risk factor. Then apart from that, we can talk of lack of exercises. Lack of exercises impairs circulation. So exercises are important. If you're not exercising, you may increase the chances of suffering from a stroke, because when it comes to fats and cholesterol, they will just be accumulating in the blood vessels. Use of oral contraceptives. Oral contraceptives increases the chance of absorption of cholesterol in the blood vessels. So if you excessively use oral contraceptives for a long time, you're at high risk of suffering from a stroke. Therefore, you need to be exercising, doing other methods, and also you can change the contraceptives maybe to injectables or other types of contraceptives. Smoking increases absorption of cholesterol in the blood vessels, which may narrow the blood vessel, increasing chances of developing a thrombus or an emboli. You have gout, cardiac enlargement, and history of cerebrovascular accident. So some patients may be predisposed to a stroke because they have a gene in them which predisposes them which predisposes them to suffering from a CVA. Just because of genetic predisposition, someone may just have a gene in them whereby if there's just a minimal disturbance, they may suffer from CVA. So if you have someone who suffered from a stroke in the family, take extra precaution to keep yourself safe because you are genetically predisposed to suffering from this condition. So having looked at the risk factors or the predisposing factors, what are some of the clinical manifestations that you can see in an individual with who has suffered from a stroke? So the first clinical manifestation that we can talk about is sudden loss of consciousness or deterioration in the level of consciousness. Someone may just collapse suddenly, and this is because there is an interruption of oxygen supply to the brain tissue. Apart from that, there is also paralysis, which is also called hemiplegia, meaning this patient is going to be paralyzed on either the left or the right side of the body, not both sides at the same time. No, it will just affect one of the two sides. Apart from that, there may also be paralysis of the other unaffected side if the patient suffered from a second stroke. So apart from those clinical manifestations, there may also be numbness, which is hemiparesis. So there may be numbness or partial paralysis of the extremities. A patient may experience numbness, and this may be the early symptoms um, of a patient going to a stroke, because at that point blood supply to body extremities may have reduced. There's also gradual onset of dizziness, mental disturbance, or seizures. So whenever there's a disturbance to oxygen supply to the brain, the patient may become dizzy. They may have mental disturbance because brain cells can't function properly due to deteriorated level of oxygen in the brain, and also other nutrients. The brain needs glucose. If blood cannot be transported nicely to the brain, meaning it won't be receiving the nutrients that it is supposed to have. There's also aphasia, which is loss of speech. So when the speech centers are affected due to lack of oxygen supply to the brain, it will result in death of brain cells. Then this patient is going to experience loss of speech. Then apart from those characteristics, there is also forgetfulness. So forgetfulness is another clinical feature um, of CVA. Apart from that, urinary incontinence. When someone suffers from a stroke, it could be the nerves innervating the urinary bladder are affected. Therefore, this patient ends up having urine incontinence. Then also visual impairment is another clinical manifestation, and this could be due to lack of blood supply to the retina. Then someone ends up having visual impairment. Loss of sensory perception, and this patient may even have difficulties in visual, tactile, and also auditory perception. So these are some of the clinical manifestations that can be seen in CVA. Whenever you are studying any condition, at least be able to tell 5 major clinical manifestations in that condition. This will help you even answer other questions whenever you are asked, because you need to be able to tell clinical manifestations for you to be able to answer a particular condition. when it comes to management of cardiovascular accident, the most cardinal management will be mainly in the nursing management. But nevertheless, we'll talk about the medical management because there are certain drugs that you can give depending on what has caused the stroke. So when it comes to medical management, as usual, you need to start with the investigations, 5 investigations, and your first point should be about history taking. So this patient may present with history of sudden um, loss of consciousness. So they may present with maybe history of sudden loss of consciousness, or it could be even history of CVA in the family. Then during physical examination, the patient may present with the hemiplegia of the body part or paralysis of the body of the side of the body. Then when it comes to investigations, some lab and radiological investigations, you can do a cerebral angiography. So a cerebral angiography, this one shows disrupted blood supply. So it will show disruption in blood supply. So when you do a cerebral angiography, it will show disruption in blood supply. Then apart from that, you can do a computerized tomograph, which is a CT scan. So a CT scan will detect structural abnormalities such as edema and lesions and also aneurysms. Then apart from that, you can do a magnetic resonance imaging, MRI. So MRI, this one will allow evaluation of the lesions, location, and also size without exposing the patient to radiation. So if you mention these 5 investigations, you are home and dry. So you need a minimum of 5 investigations, 1 history taking point, 1 physical exam, either 3 radiological or 3 lab investigation, or a mixture of the last, either 2 lab and 1 radiological, but in total you need to have 5 investigations. So apart from these 3 that I've mentioned, you can do an ophthalmoscopy. So ophthalmoscopy, this one will show signs of hypertension and atherosclerotic changes in the retinal arteries. Then you can also do an EEG. An EEG may detect reduced electrical activity in an area of cortical infarction. So EEG, this one is done to the head or the brain. Apart from that, you can do coagulation studies. They may review maybe increased clotting time, or even it may review in fast clotting time. You can also do a full blood count. You check hemoglobin levels. But those are the investigations that can be carried out in this condition. So after investigations, the next thing will be now treatment. What drugs can be given in this condition? I've already mentioned to say mainly it will be about nursing management because it will involve rehabilitation of this patient, dietary, and also some more drugs, of course. But when it comes to drugs, you can give drugs such as maybe a corticosteroid, such as dexamethasone, and this one minimizes associated cerebral edema. So it minimizes the edema, and you can give orally 0.5 to 9 milligrams daily. If you are giving intramuscular, you can give you can also give 0.5 to 20 milligrams. If it's a child, you can give between 200 to 500 microgram per kg body weight daily. So these are the drugs that you can give in terms of dexamethasone. That's the dose, and then for this drug can even be given between 2 to 10 days in terms of the interval. Apart from that, you can give analgesics such as paracetamol 1 gram to relieve the headache 6 hours, meaning 4 times a day. Then you can also give anticoagulants. So anticoagulants such as heparin can be used in cases of cerebral thrombosis or embolism. And The dose you can give 10,000 to 20,000 units every 12 hours or twice a day, or you can give 250 2,500 rather 2,500 units per kg body weight, again also twice a day. So these are some of the drugs that you can give. So you need to look at the mechanism of action, at least two side effects, and one nursing implication for you to be able to have complete understanding of each drug. And when it comes to medical management, you need to mention all those things for you to get the full 5 marks for each drug. Okay, we can move on to the complications. Rather, before we talk about the complications, we can talk about the nursing management of CVA. So when it comes to nursing management, this condition is an emergency condition. So you can have aims such as to maintain a clear airway, to maintain patient's nutritional status, to rehabilitate the patient, and as usual to prevent complications. So you need standard 4 aims or objectives. From there, you are going to resuscitate this patient, meaning you are going to have a next heading, which is patient resuscitation, and you have headings such as the airway, breathing, and circulation. So on the airway here, you need to make sure that you maintain a clear airway. You can if the patient is unconscious, you are going to nurse the patient in supine position with the head tilted to the back to maintain a patent airway. But once this patient recovers, you can nurse them in semi-Fowlers, and as usual, you can make sure that the airway is patent. Apart from that, this patient is going to have paralysis, meaning there's high chance that they can aspirate saliva. So you're going to do suctioning. So apart from that, you suction to maintain a patent airway. You can even remove any physical particles blocking the airway. From there, you go to breathing. On breathing, you say, I will check the oxygen saturation using a pulse oximeter. If the oxygen saturation is below 90%, I will give 3 to 5 liters of oxygen per minute. Apart from that, you can also check the rising and falling of the chest, which may indicate stress in breathing pattern, or it may indicate respiratory failure. Then when you go to circulation, you need to give fluids. You can give fluids such as normal saline, which is a blood expander. You can give 5 ml per kg body weight. And then you can also give dextrose for energy. And if there is a loss of electrolytes, you can also give ringers lactate. Afterwards, you can now talk about the headings such as the environment. This patient, you need to nurse them in the medical ward on the acute bay. And as usual, the environment should have good lighting for easy observation of the patient, ventilation to promote circulation, or to promote circulation. Then apart from that, you can talk about dust-free environment, noise-free environment, and also the environment with all resuscitative equipment. So you can talk about all those points in your environment. From there, you can skip rest because this patient may be unconscious. Practically, they are resting. Then you can go to in terms of position would depend on the current situation of the patient. If the patient is unconscious, you are going to nurse them in supine until they gain consciousness. That's when you can nurse them in semi-Fowlers. If the patient is conscious, you nurse them in semi-Fowlers position. Observation, as usual, you need to check the temperature, pulse, respirations, and blood pressure. The temperature, you want to rule out infections, and when it comes to blood pressure and pulse, you want to check the cardiovascular or the cardiac functioning. When it comes to respiration, you want to rule out respiratory failure. And apart from that, you can also observe the general condition of the patient. If at all the patient is recovering consciousness, you can observe if there's presence of edema, meaning there's the patient is not, the heart is not functioning properly. So you can observe other things, even just the general condition of the patient, the nutritional status, and the way the patient is responding to medication or treatment. You can move on to psychological care to the patient and also the relatives. Remember, unconscious patients are able to get everything and understand everything, so you can talk to them and also the relatives. You explain the condition of the patient to them and the relatives, the disease process, the treatment, the investigations being done on them. Explain to them to gain cooperation and also increase understanding, which may also allay anxiety. Apart from that, ventilate all the questions that the patient's relatives have. So you can talk about all those points on psychological care. Apart from that, you can also involve an individual who has suffered from a similar condition but they are healed to give psychological support. Talk about hygiene. This patient is going to be bed rest, so hygiene as a heading should not miss. You can do oral care, nail care, hair care, bed bath, bed making. All those points needs to come out under hygiene. Then from there you can move on to exercises. Exercises are important in this condition, so you need to do passive exercises so that you promote the circulation. And once the patient regains conscious, you need to advise the patient to see a physiotherapist, because they will need one for them to regain full mobility. Apart from that, they can also see a speech therapist for them to be able to speak properly. Then you can also talk about apart from that, you can talk about medication as a heading. You just say, I will ensure the patient is taking prescribed medications such as heparin, analgesics such as paracetamol, and also dexamethasone. I'll explain the side effects of the drug, the importance of taking the drug, and everything you need to explain in terms, you need to give those points on medication. Then talk about elimination. Under elimination, you need to check the input and output to rule out fluid overload. This is unconscious patient. They may be losing too much fluid due to incontinence, or they may not be even passing urine because urine is or fluids are just accumulating in the bladder. So talk about all those points they need to come out, and that will be the end of your management. So if you have your management outlined in that manner, you are assured of getting the full marks if this is during an exam. But if you just manage this condition anyhow, you're not going to get the marks that you need to get. Just remember to say this condition is an emergency condition. Therefore, in terms of nursing management, you need to start with emergency management before you bring in a prophenema headings. Then from there, in terms of complications, rheumatic heart disease can result in complications such as encephalitis, brain abscess, pneumonia, because this patient is bedridden, so they may have a hypostatic pneumonia. They may have sensory impairment, they may also have visual impairment because there's reduced oxygen supply to the retina. They may have contractures, aspiration, so all those complications can be seen in a patient who has suffered from a stroke. So this is where we'll end with cardiovascular accident, and we defined the condition. We have talked of the causes, which are basically three: thrombosis, embolism, and hemorrhage. We talked of some risk factors or predisposing factors, and we went on to look at the clinical manifestations or the symptoms or the signs and symptoms of CVA. Then afterwards, we talked of the medical management, and I've said this: start with investigations, then treatment. Then afterwards, we went on to look at some drugs that can be given in this condition. And the standard is that you need to mention at least 3 drugs which will give you full marks. Then from there, we want to look at the nursing management, and I've said this is an emergency condition, so you start with the patient resuscitation. Then I've looked at the end, we have looked at some complications that may arise due to cardiovascular accident or stroke. So this is where we'll end with our lesson today. Thank you so much for taking time to go through this lesson. We'll see you next time as we look at other conditions.